Assalamu alaikum. I am Dr. Nosheen Rahman, Assistant Professor of Department of Pathology. Today I am going to discuss about inflammation. This chapter is very crucial for learning medicine. At first I am going to tell about inflammation word. This is originated from a Latin word that is inflammatio. In English the synonym is inflame. Inflame means to set fire. Inflammation, in short, it is a protective response of living vascularized tissue to injury. It prepares the tissue for healing and repair. The goal is to remove the offending agent and replace the injured tissue. War is the metaphor of inflammation. Both are more or less stereotyped response to outside threats. There are specialized troops which are white cells, including suicidal commanders, that is neutrophils. There are supply routes, that is blood vessels. Communications and intelligence are here mediators, and huge array of lethal weapons, that is inflammatory enzymes. Inflammation is a response of vascularized tissue to infection that brings cells and molecules of host defense from the circulation to the site where they are needed in order to eliminate the offending agents. The causes of inflammation are most commonly physical agents, that is heat, cold, radiation, chemical agents, that is organic and inorganic toxins, infectious agents, that is bacteria, virus, parasites, immunological agents, that is cell mediated and antigen antibody, deprivation of blood supply and foreign body are also the causes of inflammation. Historical highlights of inflammation is Celsus in 1st century described about the 4 cardinal signs of inflammation. Later Varcos says the 5th sign, that is loss of function. Later on John Hunter, Louis Ely and Sir Thomas Lewis tell about inflammation time to time. Sir Thomas Lewis in 1924 performed experiments on inflammatory response, today well known as Lewis triple response, where red line is capillary dilation, flare is arteriolar dilation and wheal is exudation and edema. The signs of inflammation are rubor, that means redness, tumor means swelling, calor means heat and dolor means pain. To this the 5th sign is loss of function, which is functio laesa, was later added by Varcos. Now this redness is caused by mainly dilation of arteries which increase blood flow, then heat is caused by increased chemical activity and increased blood flow to the skin surface. Swelling is caused by accumulation of blood and damaged tissue cell. Pain is caused by the direct injury of nerve fibers or pressure of hematoma on the nerve endings, chemical irritations like bradykinin, histamine and prostaglandin, and loss of function is caused by increased pain or swelling. The terminology is ordinarily given by putting the suffix itis, that is itis, to the name of the site. For example, inflammation of appendix is known as appendicitis, so on tonsillitis, pancreatitis and meningitis, but always there are some exceptions like boil, pneumonia, abscess, these are also known as inflammation. Now inflammation of the ovary is known as ophoritis, inflammation of the testis is known as orchitis and inflammation of the salivary gland known as sialadenitis. These all are exceptions. Here we can see a appendix which is normal, which is almost 7 centimeter in length. Also there is an inflamed appendix where it is reddened and swollen. The inflammatory response has many players. These include circulatory cells like neutrophil, eosinophil, basophil, lymphocyte and monocytes. Connective tissue cells, that is mast cell, macrophage, lymphocyte, fibroblast, extracellular matrix like fibrous tissue, gel, proteoglycans, adhesins, that is fibronectin, circulatory proteins like clotting factors, kininogen, vascular wall cells, that is endothelial cells and all. Inflammation, is it a double-edged sword? Although inflammation helps clear infection and other noxious stimuli and initiates repair, the inflammatory reaction and the subsequent repair process can cause considerable harm. Now, there is the advantage and disadvantage of inflammation. At first, we can say the advantage of inflammation, that is localize and isolated injured the tissue, neutralize and inactivated the toxic substance, limit the growth of the microorganism and counteracts their effects, repair the area of wound healing and repair. Disadvantages are it is a life threatening hypersensitivity reaction may mediate by the insect bites, drugs and toxins. It can repair the fibrosis, may lead to disfiguring the scars or fibrous bands that cause intestinal obstruction or limit the mobility of the joint. The pain and swelling can lead to varying degree of disability, rupture of the viscous, severe hemorrhage and all. Today I am going to end this lecture and it will be continued in next lecture. Thank you.